Our teeth, we all have them, and we almost all take them for granted. Until one day, and if that's you, what are you supposed to do now? Is it possible to get your teeth back, or are you going to be stuck with something like this? Today, we're going to talk to Dr. Slovan, a restorative dentist here at Nuvia, to find out what determines whether or not someone is a viable candidate for our all-on-4 procedure. And we'll also introduce you to some of our recent patients and show you how we were able to restore their function and their smiles.
Hi, I'm Dr. Slovan, and as a restorative doctor here at Nuvia Dental Center, part of my main duty is to determine whether or not you're a candidate for a set of full teeth. My primary goal is to look at how much bone and how many teeth you have available. Let's quickly recap exactly what the all-on-4 system is. The all-on-4 dental procedure consists of removing any diseased and remaining teeth, placing any needed bone grafting material, and then placing 4 appropriately spaced out dental implants, then adding the prosthesis. We're going to look at 3 categories of patients: mobile teeth, some teeth, and patients who are fully edentulous, which means they have no teeth. If you are in a situation where you've lost all your teeth, we have to assess whether or not you have enough bone remaining for implants. Over time, when you don't have teeth or implants putting pressure on the bone, you lose bone. So year after year, you lose a little bit of bone. If you wait too long, you may not have enough bone for implant placement. A great example of somebody who came to our office with no teeth or totally edentulous is Terrence. Terrence had lost his teeth before the age of 30 and had experienced broken dentures, missing dentures, ill-fitting dentures, ones that came out while eating and talking. And he explored multiple replacement options over the years, but just couldn't find something that he was looking for until he came upon Nuvia. Once we brought Terrence back and obtained a scan, we were then able to go into the scan and analyze if he had enough bone to hold the implants. So we kind of virtually placed the implants, and it gives us an idea of the bone width and volume and height that he has available. And as it turns out, he had plenty of bone on the upper and the lower arches to be able to place 4 implants on the upper and 4 implants on the lower without any problems.
Whoa! Right.
Yeah.
Wow.
Another option we have to look at is if the patient presents with a couple teeth left in their mouth. We have to determine if these teeth are healthy enough to keep. If they are, the patient will then have options such as single implants, bridges, and removable dentures. Remember, we never really want to take out any teeth that can be saved and are healthy. If you're a patient who has some remaining teeth in its mouth, then David is going to be a great example for you to pay attention to. David had 1 tooth remaining on his upper arch and about 8 teeth to 9 teeth remaining on his lower arch. No posterior teeth on either arch. So we took David back, performed a scan, and we were able to see if he had enough bone availability on the upper and lower arches for 4 implants on each. David was a candidate for the all-on-4 procedure. After removing his remaining tooth on the upper and broken roots, we placed 4 implants, and on the lower we removed the remaining teeth, which were full of decay and mobile. They weren't in pristine condition, so we removed those and were able to place 4 implants on the lower.
All right, there it is.
David had followed our protocol to a T of icing and medication 24 hours after surgery, and David presented with minimal swelling and minimal discomfort. Lastly, we have to look at the patient who has teeth remaining, but they're still mobile. The mobility comes from bone loss around the teeth, so we have to assess whether we have enough bone to place implants, or if we don't have enough bone, the patient will need a denture. When it comes to loose teeth, a great example of a patient that came to us was Anna. Anna came missing several back teeth. She had periodontal disease, which is a fancy word for bone loss, that affected her upper and lower front teeth, and because she had no back teeth and she was biting on these upper teeth and chewing on these upper teeth repeatedly, they became mobile. So she was not able to eat a lot of the foods that she liked due to the mobility and discomfort of her teeth that were primarily due to bone loss. Once we brought Anna back for her scan, we were able to take a look and assess how much bone loss she had in the areas where she did not have any teeth and the areas where she presently had teeth. And we were able to virtually place implants in these areas and see if it was something that was going to work. Now fortunately, Anna had enough remaining bone in the areas where she didn't have teeth and the areas that she had teeth, which are going to allow her to receive 4 upper implants and 4 implants on her lower arch.
Right? Oh my God. That's great.
Well, I hope this has been helpful to you in determining if you're a candidate for our all-in-4 procedure. If you'd like to know more information and take a 60-second quiz to see if you're a candidate, please click up here. And if you'd like to see some more amazing videos, please click down here.